Thank you, Mr. Speaker. This is National Addictions Week, and I'd like to congratulate two Kainai physicians who have been honoured by the University of Lethbridge with this year's Friends of Health Sciences Award. Dr. Susan Christensen and Dr. Esther Tailfeathers launched several successful initiatives to save lives on the blood reserve, where fentanyl has taken a terrible toll. To the Minister of Aboriginal Relations, given the success, leadership and persistence of these doctors, what are you doing specifically to save the lives of Albertans on other reserves?
Minister of Health.
Thank you very much, Mr. Speaker, for the question, to the member for raising it. Certainly, fentanyl is one of the most extreme drugs that we've seen in our time. Doctors are talking about the very extreme consequences of having so much as just 2 grains of fentanyl. And we're working on a 4-pronged approach. One piece is making sure that we have education and public awareness campaigns. One piece is working to make sure that we have naloxone kits in the hands of people who are likely to have an overdose and the people who care for them. We're also working to address the manufacturing and trying to create greater barriers between it being brought into Alberta. And lastly, we're working to make sure we have this crisis centre in place, as well as investing in detox opportunities.
First supplemental.
Thank you to the Health Minister for the answer. Again, to the Aboriginal Relations Minister, given that you committed last week to outline your department's efforts to ensure that the life-saving antidote naloxone is available on all Alberta reserves, and given that any delay in setting up the system means lives lost, what are you doing specifically to ensure that all First Nations reserves have a ready supply of naloxone and residents are trained to administer it at a moment's notice?
Minister of Justice.
Thank you, Mr. Speaker, and to the member for the question. Well, of course, this is a critical issue for all Albertans because fentanyl is a very dangerous drug, and the antidote naloxone is one of our key pieces in addressing this situation. We have been working with policing agencies on reserves. We've also been working with First Nations directly, and we'll continue to work with medical EMS services, as well as working on information, because it's really critical that we work with our partners in health to ensure that the information on the danger of this drug gets out so we can prevent people from taking it in the first place. Thank you.
Second supplemental.
Again, to the same minister, given that the Blood Tribe Police Service launched an extremely effective on-reserve crime unit dedicated to gaining control of fentanyl distribution, what specific, and we are looking for specifics here, Minister, what specific plans do you have to adapt the Blood Reserve's successful state of emergency model on other reserves that are trying to get a handle on fentanyl abuse and distribution in their area?
Mr. Justice.
Thank you, Mr. Speaker, and to the member for the question. Well, of course, we have a number of police forces throughout Alberta. Policing on First Nations, there are a couple of other First Nations that have their own policing forces, but majority of it is done with the RCMP, so we are working with those partners to ensure that they have access to this drug and that they have access to all the information necessary going forward to make sure that they can cut off the supply. Thank you.